Hello, everybody, and welcome to Kansas Town Hall Research Release and Press Conference. I am Stephanie Morello, the Director of Marketing and Communications for United We. We still have a few people coming in, so I'm going to go ahead and continue to let everybody in from the waiting room, and we will get started in 1 minute. Okay, good morning, everybody. Welcome to the Kansas Town Hall Research Release and Press Conference. I am Stephanie Morello, the Director of Marketing and Communications for United We. Before we get started, I just wanted to outline a few housekeeping notes for everybody. First, please mute your microphone during the presentation so everybody can hear. Second, we will be recording today's conversation. We will go ahead and send this out following the press conference, and it will be available also on YouTube for anybody who is unable to attend. And third, we will have a Q&A at the conclusion of the presentation. But in the meantime, please feel free to type your questions into the chat during the presentation, and we will address as many as possible at the end. We will also unmute microphones if you would like to ask your question verbally. Now I would like to introduce our speakers. First, we have Wendy Dill, President and CEO of United We. Wendy will be discussing the research from the Kansas Town Hall Listening Initiative, as well as sharing more about United We. Next, we have Mark Meads, President of the Ash Grove Charitable Foundation. The Ash Grove Charitable Foundation has been a long-time supporter of our mission and was one of the generous supporters who made the Kansas Town Hall initiative possible. So we're grateful to have Mark here with us. We also have Commissioner Sarah Kaler from Ottawa, Kansas, who will be speaking on behalf of the League of Kansas Municipalities. As a longtime collaborator, the League of Kansas Municipalities was our strategic partner in the Kansas Town Hall. So thank you all so much for joining us. Again, please continue or please stay on mute until the Q&A section at the end. And Wendy, I will pass it over to you.
Thank you, Stephanie, and good morning. I'd like to start by telling you a little bit more about United We and why we actually developed the Kansas Town Halls initiative. First, our mission is to advance all women's economic and civic leadership. To make meaningful change, everything we do is rooted in data. It is critical to identify specific barriers to women's economic development and then create smart, practical solutions to overcome them. We prioritize both quantitative and qualitative research. Earlier this year, we released an update to United We's Status of Women in Kansas report, which we commissioned with the University of Kansas. The quantitative research revealed the true roadblocks women are currently facing, including pay equity, lack of access to affordable childcare, limited paid leave, entrepreneurship restrictions, and more. The Kansas Town Hall Listening Initiative really supported that quantitative research by really gathering qualitative information to understand the reasons behind these challenges. We held 7 town halls in all corners of the state to gather women's feedback and experiences. You can see the locations on the slide. More than 500 women and allies from across Kansas, dozens of women took advantage of the free childcare offered at each town hall, which allowed them to fully participate in the conversation. On the next slide, I'd like to personally thank the Kansas Women's Economic Development Task Force for their leadership during the town halls. You see this incredible group of women on the slide here. This group of 34 women from across the state represented geography, industry, and also diversity in general, really helping us to promote the town halls across the state, increasing attendance and representation at each town hall. If you are joining us today, if you wouldn't mind just raising your hand or dropping your name into the chat if you participated on the task force so we can recognize you. This was a tremendous leadership opportunity for this group of women. I'd also like to thank the United We team. This was a tremendous team effort. We worked closely together as a team to really make this initiative happen. So thank you to the United We team. I'd also like to thank our sponsors on the next slide, the Ash Grove Charitable Foundation, Bicknell Family Foundation, the Patterson Family Foundation, and United Healthcare for their tremendous support to really make these Kansas town halls happen. I'd like to invite one of our supporters, Mark Meads from Ash Grove Charitable Foundation, to say a few words. So Mark.
Thank you, Wendy. It's a pleasure to be here today with all of you. Ash Grove Cement Company is one of the largest cement companies in North America and one of the oldest still in operation. Ash Grove plays an important part in the foundation and infrastructure of our country, and this includes the advancement of women. Ash Grove has been supporting United We's work since 2015, and I've personally witnessed the significant impact across the Midwest. The model of utilizing qualitative and quantitative research to clearly identify barriers for women and to find innovative solutions works. We are grateful to play a role in further improving the economic and civic development of women right here in Kansas. For me personally, I know there's a role for all of us to play in this work. Women, men, business leaders, media, we are all responsible for recognizing the way women are being held back and then take correction to correct it. When we all work together so more women can participate in the economy, our families and communities thrive. On behalf of everyone at Ash Grove, thank you for being here today. You are part of a big first step to transforming lives, families, and entire communities. Wendy, I'll turn it back over to you.
Thank you, Mark. And I'd also like to thank you for hosting us in Chanute, Kansas, where the location of the actual cement facility with Ash Grove is held. We had a tremendous conversation. So we're grateful for your support, leadership, and allyship, and continued support moving forward. So thank you, Mark. Next, I'd like to invite Commissioner Sarah Kaler from Ottawa, Kansas, who is representing the League of Kansas Municipalities. They were a tremendous strategic partner for this initiative. And so, Sarah, I'd like to invite you to say a few words.
Thank you, Wendy. Thank you so much. And thank you all for being here today. My name is Sarah Kaler, as Wendy had said, and I am the former past president of the League of Kansas Municipalities. Now, you may not know what the League is, but let you know first that I'm from the city of Ottawa, and I've served as the mayor and the city commissioner for the last 12 years here in this great city. I'm so excited to be with you guys today. Thank you for the partnership with United We. The League is super excited to have that. The League of Kansas Municipalities, which is often referred to as the League, is a member-based association. We serve local government resource and serve as a resource to cities and have since 1910. We advocate for cities at the state capitol. We provide legal assistance to cities. and professional development to mayors, city council members, city staff, probably somebody who is helping to serve you in your community right now. Our mission is to strengthen and advocate for the interests of cities, to advance the general welfare, and promote the quality of life for people who live within cities. Now, what you may not know is the League represents member cities from a population of 20 to 390,000, which are home. And in Kansas, cities are home to over 80% of the entire population of Kansas. So more than likely you live in a city in Kansas, and thank you for doing that. We know that there are challenges that exist, and certainly this has been brought out in the research that has been done with United We. But this morning, I was thinking about the change in the weather, and I don't know if you have the white stuff on the ground that I do in my front yard, but I noticed, change is not always easy. My kids had to wear coats today and they didn't necessarily want to, but change is not always easy, but it's worth it. And together with United We are excited to collaborate with this great organization to improve local government, and change community engagement. Women are an incredibly critical part of this success in cities, and we appreciate joining United We as a part of this and being a change in women's lives. Thank you for being here today. Starting today, let's start working on making Kansas the best place to live, work, and play for women, men, and every single Kansan. Thank you again.
Thank you, Sarah, and great words to kind of wrap up there. We, again, are grateful for your leadership as well as the League's partnership in this initiative and looking at how we can work together moving forward. Now, I'd like to turn to the key findings from the Kansas Town Hall report. At each town hall, United We collected both qualitative and quantitative data through small and large group discussions. We did some surveys and anonymous polling at each location. Attendees represented diverse industries, geography, and backgrounds in each of the town halls and came together to discuss issues related to women's economic and civic participation and advancement. Sessions were free. They were open to the public, and there were included moderated breakout sessions led by community and business leaders at each town hall. We offered complimentary professional childcare at each location. We offered a complimentary lunch and a $10 gift card for participation to each of our guests. So thank you to our Kansas women for their participation. We focused on the following key areas, which you see on the screen, and they are in alpha order. So it was broadband access, childcare, civic engagement, entrepreneurship, healthcare, mentorship and sponsorship, occupational licensing, paid family and family-friendly policies, pay equity, and financial stability, and workplace culture were the topics that we discussed. We took some deep dive into some of the deeper dives in some of the conversations, but covered all of those topics. What we heard from hundreds of women is that they want to participate in the workforce and are doing everything they can to make it work. Unfortunately, there are structural barriers preventing women from fully participating or succeeding. On the next slide, to put this into context, I'd like to share some quotes from the women we met across Kansas. And these are just a few of the stories that we heard, but I think it'll set the tone for the quantitative information in the report. So this woman reported from Hayes. She said, "I know if I have another child, I won't be able to keep my job financially due to the childcare expenses." Equal pay in Garden City, one woman shared with us, "They hired me because I was twice as qualified as anyone else, but I was still paid less." In Topeka, it's one thing to have equality, it's another to have it for women of color. And finally, we also heard this: "Don't make decisions about me without me." That was from Topeka. We listen to women about the economic barriers they face today across Kansas. Now it's time to remove these barriers and help women reach their full economic and civic potential. The insights I'll share today are not exhaustive of our research and the stories we heard, but highlight some of the key themes and key areas for impact. You can access the full report by visiting our website after today's presentation. To read the full report, you can download it, and it is accessible, so we hope that you do so. So first topic I'm going to cover, again, in alpha order, is broadband access. Access to affordable and reliable internet affects women's ability to work from home, own and running businesses, and access to telehealth and mental health care services. We heard this time and time again throughout our town halls across the state. Broadband access affects opportunities for continuing education and additional training and certifications needed to advance in the workforce. Internet access is really limited in rural parts of the state, and there is often only one or two providers available, which results in higher costs for the users. Despite the perception that broadband is more accessible in urban and higher populated areas, many women are still without reliable and affordable access. So what are we going to do? We will be sharing this data with the Director of Broadband, which is a new position in the state of Kansas. We will also continue to advocate for infrastructure to expand broadband access in rural areas. We certainly know the state of Kansas is receiving some American Rescue Plan Act federal funding to really address this, but we will continue to prioritize this and make it far and wide known what the issue is. Next, the issue that I want to cover is childcare. Childcare was a critical topic at every town hall. Here's what we learned. We learned that childcare costs are really unaffordable. For many Kansas women, the cost of care equals or surpasses their monthly income, making it hard to justify staying in the workforce. The supply of licensed childcare providers in the state of Kansas does not meet the demand. But state licensing requirements and low wages create barriers for new providers and staff shortages. We have multiple plans in place to address these barriers affecting women's ability to work and providing care for children. I'll highlight just a few of the opportunities for impact that we'll be working on. First, we were instrumental in passing this past legislative session a child care tax credit for the state of Kansas. We're really proud that Governor Kelly signed that into law in the month of July, and we will continue to be looking at economic opportunities for the state of Kansas too. We also, United We was recently awarded a grant to conduct a national childcare research study. So we're really excited to be launching this effort to continue to dig a little deeper in an issue we feel is important, which is we will be reviewing every state in the country's states licensing requirements and really identifying who's doing it really well and bringing those best practices to the state of Kansas as reducing the barrier for childcare facilities to open. On the next slide, in civic engagement, this is something that's really near and dear to United We's heart. We heard several things from Kansas women, including a lack of interest in entering the current political environment prevents women from running for office. There is a lack of awareness, training, and ongoing support or mentorship, also preventing women from more civic engagement opportunities. Following the Kansas Town Hall series, we had 110 women of the 500 attendees that indicated they are interested in learning more about United We's Appointments Project and serving in a leadership role, a civic leadership role in the state of Kansas. So again, an opportunity for education, mentorship, and engagement in the state. On the next slide for entrepreneurship, several women shared that they want to start businesses, but there are obstacles preventing them from doing so. And entrepreneurship endeavors, barriers that we heard include the following. Women cited reasons such as flexibility with children and childcare and the need for additional income as reasons for starting their own full-time or part-time businesses. Women indicated that access to health insurance was a barrier to starting their own businesses. business owners indicated that spouses having healthcare coverage really allowed them to pursue their dreams and start their own businesses. Women lack individual relationships with banking institutions, which really affects their ability to access capital when forming businesses and limits their awareness of important financial information and resources to grow, launch, and sustain their businesses. Women indicated that limited business resources, connections, and networks have negatively impacted their business endeavors. Access to capital is critical for women entrepreneurs. We heard this hands down across the state of Kansas. So our plan will be, we will share our town hall findings with key groups across the state, including the Kansas Bankers Association, to really encourage stronger relationships with women. We'll also share the key findings with nonprofits and other business leaders who could provide support to women who are interested in launching a business in the state of Kansas. I'd also like to give a shout out. Saturday is Women's Entrepreneurship Day. So I encourage all of our viewers today to get out and support a local woman-owned business. On the next slide, healthcare was another key topic that we talked about significantly. Access to affordable health insurance is critical for women evaluating job opportunities and also retention in the workforce. Employer-provided health insurance dictates many women's career choices. So again, really determining some women expressed interest in starting a new business, but healthcare coverage was so critical to their family, they opted to stay employed versus starting their own business. Women often prioritize the health of family members, especially their children, over their own healthcare needs, including mental health care needs. Home health care and elder care options are lacking across the state, especially in rural parts of the state. We heard this time and time again, that women have the caregiving responsibilities, and lacking elder care support in more rural parts of the state really falls back to women. There's a high degree of distrust of health insurance companies, and that was through an anonymous polling that we did at each town hall. Real distrust and lack of empathy for recipients of health insurance. We have an opportunity to improve access to affordable quality health care is an opportunity for impact for the state of Kansas. Telehealth is also a priority that we're going to be focused on. In 2021, there was a special interim committee at the state of Kansas on telehealth, which brought legislation to the full legislature during session in 2022. Unfortunately, that bill died, which focused on really bringing back telehealth accessibility across the state. That's something that United We is going to take a look at. Additionally, the pharmacist point of care program, which allows pharmacists to test and treat common conditions like the flu and strep at a pharmacy without requiring a doctor's office visit, which can save travel time and expenses, is another issue that United We is going to prioritize to really address the healthcare challenges. Occupational licensing is our next issue that we'll talk about. This is something that has really been a priority for United We for the last several years. We really know that it's a priority because women hold a professional license at 3 times the rate that men do, which really elevated this as an issue at United We. Women in Kansas are more likely to work in fields requiring occupational licensing, ranging from cosmetology, education, nursing, and dental, as just an example. Occupational licenses are also affecting individuals and business owners with delays to providing a service in critical areas such as therapy, therapists, and in-home daycare. Educational and licensing requirements are impacting women in immigrant and refugee communities. We heard that also across many of the town halls, especially in rural parts of the state. What United We's plans will be moving forward, we're going to continue to study and really prioritize specific occupational licensing professions that really are impacting women. We recently advocated for the Kansas bipartisan regulatory reform that removes a major occupational licensing barrier in the state of Kansas for eyebrow threaders. We were instrumental in doing that, and Governor Kelly signed that into law last session, which really reduces the requirement to attend cosmetology school, which is on average about $15,000 in the state of Kansas, and 1,000 hours of training to really just go online and fill out an application to become a licensed eyebrow threader in the state of Kansas. On the next slide is paid family leave. Family-friendly workplace policies were critical to participation and retention of women in the workplace. Here are some of the things that we heard. Many Kansas employers do not offer paid family leave. Women without access to paid family leave are forced to use paid time off or sick leave to care for family members. With limited paid family leave policies and programs offering pay for caregivers, women are negatively impacted financially and in career growth and stability when taking time off or missing work to care for aging family members or their children. Many women who have PTO prioritize medical care for family members over their own personal healthcare needs. Like childcare, women struggle to balance careers and also being a caregiver. United We will continue to advocate for 12 weeks of paid family and medical leave and 100% wage replacement for all workers. We were instrumental in working with Governor Kelly to elevate a paid family leave policy to 8 weeks, from 6 weeks to 8 weeks, and also adding foster care. And we will continue to prioritize that and encourage businesses to follow the lead of the state. Pay equity and financial stability. So finally, in closing with pay equity, women in Kansas face the compounding challenges of lower earnings and having to take time off to care for children and family members, which means when they step out of the workforce to start a family and re-enter, there starts to be a pay gap there. It also is compounding with not being able to contribute to retirement funds. Many companies do not even offer retirement matching programs, which also impacts a woman's ability to save over a lifetime for retirement. Pay equity must be addressed across the state. So we will continue to educate employers how just a simple tool of banning salary history on employment applications really levels the playing field between women and men for the same position. We also will continue to share our pay equity best practice guidelines with elected officials and businesses. And again, for our viewers today, this is a research study that we did a few years ago and is accessible on our website. So please visit our website for the pay equity best practice guidelines. And the Work and Save program, which is something that we'd like to see implemented in Kansas. It's a framework for a savings program housed outside of employment centers. Programs like this make it easier for women, particularly women in highly mobile professions or those who are thinking about starting a business or have a business, to start saving earlier. So those are some of our key findings of our town hall report. And I know we've covered a lot of ground in a short period of time, but again, I think you get the flavor. It was robust conversations in every part of the state, in every town hall. On our next steps and opportunities for impact, which is really, getting to work and identifying how we are going to see some change in the state of Kansas. We leveraged our town hall report findings as well as the 2021 status of women in Kansas. So both our qualitative research study from just hearing the stories from Kansas women and the detail and the data from the quantitative research study here to really identify the top barriers, and then coming up with, here are some opportunities for the state of Kansas. Our findings show there is no one-size-fits-all policy solution to reduce these barriers, and there are so many more opportunities for collaboration and really movement in the state to really grow our economy. Elected officials, businesses, funders, nonprofits, and just Kansas residents must continue to explore and emphasize a multi-solution and a collaborative approach to really strengthen our Kansas economy. So now I'd like to open it up for a few questions with the remaining time that we have.
Thank you, Wendy. We did receive one question to the host about what can we do as individuals to help progress women in Kansas?
I think that's a great question, and just want to thank the viewer for the question. And one thing I'd like to suggest is read the report from front to back and also access the Status of Women in Kansas report. I think one thing that we can do is further educate ourselves and in our circles of influence about the critical issues that are impacting women across the state, and start to talk and message about it. I think, you know, the one key thing that we learned from the Kansas town halls when we, at the conclusion of each session that we hosted, is women aren't really comfortable talking about these economic issues. And it may be, in fact, the first time that some women had actually talked about it or expressed how it was impacting themselves personally. So I'd like to invite everyone on, you know, just further talking about it in their circles of influence. And then certainly if you're in a workplace, you know, sharing the pay equity best practice guidelines with your human resources department is another simple tool in really addressing the inequities in pay, and also being advocate in the workplace for a paid family and medical leave policy. You know, time and time again, we heard from women, you know, there isn't even a maternity option available in workplaces. And, you know, really having to cobble together PTO time and saving vacation time to be able to have a child. So we really want to be able to, you know, advocate for a couple of critical issues in the workplace. And those are simple things that individuals can do.
Wonderful, thank you. One more, or another one just came in. Do you think the Kansas legislator should be doing more to improve the status of women in the workplace?
Absolutely. I will say I commend the legislature and, you know, our executive branch leadership for really being supportive of some issues impacting women. You know, example of that is, you know, the paid family leave policy that the state is leading. You know, at all branches of government have implemented the policy, and that was a result of United We sharing with the leadership a paid family leave research study that we have that's accessible on our website. And the legislature has really been, you know, we've received some bipartisan support on occupational licensing. You know, the goal is really to reduce red tape so individuals, women and men, can get to work. And that's been something that the legislature has been extremely supportive of. Again, the opportunity that United We has is to continue to educate the legislature on the issues that are impacting women, which is why we actually spent time doing the Kansas Town Hall's work. We look forward to sharing the key findings with our legislature to further elevate the key issues that are impacting women and families. I will say, you know, the state of Kansas and the state of Kansas knows this, including our legislature. We are in a childcare crisis for the state of Kansas. More than 300 childcare facilities closed during the pandemic with no plans to reopen. So supply not meeting demand, which is really a workforce development strategy to get people back to work. Again, we heard, you know, especially in rural parts of the state where, you know, families are having to put together maybe 3 different childcare providers, you know, for 5 days of the week in order for families to get to work. It is, you know, an issue, and it has elevated it to the very top of the leadership and the legislature. So I am encouraged, you know, with that particular issue, that we're going to see some movement in 2023 with really coming up with some solutions. Again, it's a marathon, not a sprint. It was an industry that was already challenged, but I'm encouraged with the conversations that are happening. But there's certainly more work to be done with educating our legislature about the issues impacting women and families in Kansas. And United We is committed to educating them on those issues.
Wonderful. I think that is the last question that we have at this time.
Oh, excuse me. I have a question.
Go ahead.
This is State Senator Olitha Faust Boudreaux. This is a great conversation, and to the point of the last statement made regarding childcare providers. And here in city of Wichita, in my 29th Senate district. With that shortage of childcare providers, I am working with right now 3 different African-American women who have daycare centers. And I'm not sure what the problem is. However, KDHE is coming in and they've shut the 3 of them down for minor issues, things as simple as during an inspection, not having toilet paper, having an empty roll in the toilet paper dispenser. And even though the daycare provider immediately took toilet paper out of the cabinet and replaced it on the dispenser roll, she was still wrote up about it. And so as we talk about women in the work field, and as we talk about diversity, I don't know what the previous speaker is hoping that we will do in the upcoming legislative session. I don't know, changing some of the rules within KDHE, because now all of those 3 daycare providers here in the 29th district were African-American women, and all of those children that they were providing for the parents had to do something quick to get that child care to go to work. And our legislature wants people to go to work, but it's so hard to do without them having proper child care. And so I would like to leave the body here with, I recently completed a fellowship with NCSL, Early Childhood Learning, and we talked about getting our corporate businesses, our employers, more involved with helping their employees with childcare. So I don't know if anybody on here with the municipalities, are we networking with employers to help their employees with childcare? Thank you.
Senator, thank you. Thank you for your comments. And, a couple of things to the point of inspection, that is also, one of the reasons why we want to look at the licensing requirements. It's, makes it cumbersome to even open a business, but also the inspection process. And that is something that is, we've heard from several childcare providers about the challenge of the inspection process. So thank you for bringing that forward as an issue. And then also, employers in the state of Kansas can benefit from the tax credit that the legislature passed this past session, to help support their employees or offering on-site childcare as an option. So, we want to continue to look at some best practices from, other states across the country and bring those as opportunities to Kansas too. So that's our commitment as well. But thank you for your comment and for joining us today.
Thank you as well.
Stephanie, other questions?
That is all we have received in the chat. Would anybody else like to unmute and ask a question?
Hello. Can you hear me?
Hello, yes.
Okay. This is June Huey. I'm an independent business owner, and I often become a mentor to new entrepreneurs. And one of the questions that I receive, which is one of those things you really can't necessarily answer, is why can we not make men, okay, understand, I get it, men more aware of the struggles that the not high income families are having. And when they refer to the men, they're referring to CEOs, the upper end of the economic environment, because they may have a wife that can take care of that. They may have a nanny, they may have a maid, they may have whatever they have, but those are not available to the people who are just trying to make everything work. And especially if you're a new entrepreneur, you don't have any of those supports. And where do we need to go to bring the awareness to the big employers about the, particularly about daycare, because a lot of people have had to quit some of the bigger employers because they can't meet the requirements of attendance, and they can't leave their jobs if you're on a assembly line. I mean, there's just so many things that seem to impact women so much more than men. And we want to know where to start. Who do we start with?
June, I would really appreciate your comments. You know, where we can start is definitely, you know, informing and sharing the stories with your legislator in your community. And, you know, like the senator joining us today is learning, you know, about the issues, and she'll be able to take back and, you know, apply it to the 2023 session. So that is, you know, something that we need. You know, men are really good about sharing, you know, the challenges with their elected officials, but we as women can do a better job of advocating and educating about the issues as well. You know, as far as in the corporate sector, you know, and really educating the C-suite level, it is, you know, a commitment that United We continues to do, to just educate about what the critical issues. And we certainly use this tool of the status of women in Kansas, and the town halls report will be sharing that. But it's, you know, it can't just be us, it has to be a we. And so again, I think just continuing to, you know, just try to communicate and elevate the issue as we can. You know, it takes a champion internally, which is, you know, getting an ally. You know, we talked a lot about this at our town halls, just women identifying a male ally within the workplace sector to really be that champion, that supporter, that mentor, to really, you know, continue to elevate a woman in the workplace. But, you know, it's a great point. Really appreciate your comments.
I have one other small comment. Olathe Faust-Goudot has done a yeoman's work in trying to bring awareness on women's issues everywhere she goes. So it's one of those, she's one of those people that I'm not even sure that the people she works with listens to. They give her a lot of lip service, but not necessarily a lot of action. And I'm getting the same thing from city council and county commissioners, particularly here in Sedgwick County. You know, they shake their head. Yeah, we understand it's a problem, blah, blah, blah. And then they promptly go and vote absolutely against anything that they say. And there's not a whole lot we can do about it other than unelect them. But we have that whole conservative versus progressive mindset that giving us some considerable difficulty here in Sedgwick County.
Thank you. Thank you for the comment. Appreciate
Hi,
it.
Wendy.
Hi.
We have one more question here in the chat by a task force member, Emily Snyder. Have unions been explored and emphasized when addressing pay inequity? These pay gaps do not exist within unions.
Yes, thank you, Emily, for your leadership and for the comment. As far, you're right, you know, as it hasn't been explored, you know, really the goal for us at this point is just really educating, just, you know, workplace organizations and workplaces, just, you know, there's some simple things they can do today, which is, you know, implementing an evaluation process to really just determine, is there discrepancies in pay between women and men for the same work? You know, banning salary history is such a simple tool, just taking that off in employment applications. So there's some simple things that can happen today. And that's been really our focus at United We and what we're advocating for. But appreciate your comment.
Okay, I think that is all the questions that we have. So if we flip to the next slide, I would like to thank everybody for joining us today as we shared just a portion of our findings from the Kansas Town Hall series. I encourage you all to visit united-we.org/townhalls for the executive summary and the full report. Thank you all again for joining us. This will be available for rewatching, and have a wonderful afternoon.